In this video, I'm going to be talking about my history with therapy, specifically with talk therapy. So, this is a general trigger warning for trauma and abuse. However, I won't be getting into specifically what happened to lead me to go to therapy, but rather what happened in therapy. Before I get started, unfortunately, I only really had bad experiences in therapy. And this video isn't to discourage people from seeking therapy. I view it as something neutral in general that can be very helpful and advantageous towards people when they find the right provider that works for them with the right skills, knowledge, and techniques for them. Instead, I share this more to share my experience and to hopefully encourage people to look at therapy in a specific way where you're not viewing the therapist as this ultimate authority on something, and where you feel empowered to state and enforce your boundaries and do what is best for you, even if other people don't agree. While I went to therapy as a child, I'll only be talking about the therapy I did as an adult. So I am very excited to talk about this as well, to share my story and to hopefully help other people in similar situations. I had 5 different therapists during my adult life. I'm 29 now. The first therapist I had, I was around 21, I think. And I had 2 main issues with her. The first issue regarded and revolved around behavior that she was doing and comments that she made that felt very sexist to me. I wasn't out as being trans, a trans man at this time, and I had a bit of couples counseling with her, with the partner I had at the time as well. A lot of her advice seemed very centered around gender roles, and not in like a critiquing and dissecting sociologically how we got there, but in a very enforcing way, in my opinion. In particular, what upset me the most was that she talked about, basically, in brevity and in general, there was an issue I was having sexually with this partner who wanted me to do something I didn't want to do. And my therapist was basically saying I ought to do this thing I did not want to do because it's what my partner wanted from me. Right? And that's not consensual. So that was all really upsetting. The second issue I had with her, and the reason that I stopped seeing this therapist, she encouraged me to reconnect with someone from my past who traumatized me. I was open to this at this time. It had been a while, and back then in particular, I really believed in giving people unlimited chances as long as they were changing. I reconnected with this person, more surface level. It was going fine-ish, I suppose. However, this person sent me these books around a topic that I had talked about. They said these books meant a lot to them, and they thought it would inspire me in what I was doing. I read these books, and a lot was really upsetting about the books. But the thing that was the most upsetting was that these books idealized the specific type of trauma that for me was the worst that that person put me through. I gave them the benefit of the doubt. I hope that it had been so long ago they had learned and grown from their very wrong, immoral choices, in my opinion. But instead, they sent me a book that approved of them. The worst type of abuse I suffered from this person. I chose not to talk to this person again. The next time I had a therapy appointment with that therapist, I was venting to her about what happened. And I told her I'm not going to talk to this person again. I couldn't even tell this person why it was so upsetting to me. And she said that I ought to continue talking to this person. Just don't talk about the book. I understood where she was coming from. So, even though it was very upsetting, so I explained to her I couldn't even say hi to this person if I ever talked to them again. This is so traumatic and upsetting to me. So even though what she said was upsetting, I thought if I explained it to her, she would understand, or at least try to understand. But she kept trying to convince me that I ought to keep talking to this person. And I just kept saying no. I was really, really upset. And I think I did end up not speaking to this person, this therapist, after this event. The second therapist I had is the only therapist that's a man I've ever had. Now, I didn't want to see any therapists who were men before, because being perceived as a woman my whole life, I just didn't feel like they would understand a lot of my lived experiences. And I hadn't transitioned at all at this point either. However, the last therapist I had, who was a woman, was very sexist in my opinion. So I thought, well, maybe I'll give it a try, having a therapist who's a man. I also felt more comfortable with him because he was gay. So that made me feel like hopefully that meant he was also not sexist, which unfortunately is not how different oppression works. I had one issue with this man, which is that I brought to him a current issue I was having with a man in my life, someone I interacted with. And this man in my life said something in particular about a situation that does call for concern, that is serious. However, they made a comment about the situation that expressed concern for themselves instead of the actual situation, and was said in a very joking manner. And it was particularly triggering to me because this serious situation that he was joking about happened to me. So this was very upsetting to me. I found it very offensive, and I was venting to my therapist about this. Unfortunately, what my therapist said was just defending this man, which was very problematic to me, because what this man was saying really put the emphasis on not the part of the situation I thought we ought to emphasize. And beyond that, while the situation is something we ought to have been concerned with, I don't think it should have been mentioned at all. Especially not in a joking manner, right? So even if my therapist didn't understand any of that, maybe he's had personal situations for him. I was upset that my therapist wasn't focusing on that it was triggering trauma for me. And instead, I felt completely invalidated as he was defending the actions of this man who really, really upset me and I viewed as wrong. I chose not to see that therapist anymore. The third therapist I had, the remaining three are all women. The third one I had, at this point, it must have been 2022. 3, 4, 5. So I was like 25 at this point. I knew that I was autistic in this year, among a lot of other things. I also had been working with autistic kids. I worked with them for 5 years. The two things that were setting, first of all, and she acknowledged this as well, that this wasn't quite appropriate for the professional relationship, was that for the majority of our conversations, I was educating her about autism. I had lived experience with these kids. A lot was going on. I experienced this a lot in my life, not only with autism, but just when talking to people, professionals specifically, where I feel like I'm often in an educator role, and it's really upsetting to me because I'm trying to get help and I'm the client. At the same time, it used to really boost my ego, and I felt helpful, purposeful, like I had value because I could help these professionals. The reason I stopped seeing this therapist, though, was because we had some type of disagreement. It was so traumatic, I don't remember the subject. But basically, I was having a conversation with her and we were disagreeing. And afterwards, I wrote down like everything she said, everything I said. I try to analyze. And I used to do this a lot, not the writing down in particular, but having meta conversations where I'm analyzing everything going on, why people feel certain ways sociologically, past things they've done, different aspects and dynamics of relationships. And I would try to explain all that to them, like going backwards in the conversation. And it was very frustrating. And I felt very misunderstood and unseen. And now I've just come to a radical peace when it comes to being misunderstood, where now I just strive to connect with people who take pleasure in understanding me and working to understand me, instead of me trying to convince people of things. I don't remember what the conversation was about. However, I went back to her and tried to explain everything. This long document, because it was very dysregulating to me, whatever the subject was. And we just kept arguing. I don't know how long this lasted. It just didn't go very well. I never felt understood. And I didn't end up seeing her anymore. The fourth therapist that I had, when I started seeing her, she asked me to explain my past experiences with therapy. And she went on about how she would never do any of those things. I had one issue with her, which is that at this time in my life, I was going through something very stressful. And I was very worried it was going to cause something else to happen, and that I would feel a certain way about what could happen. I felt she was telling me that even if this bad thing happened, like we could make it work, or I felt like she was telling me I could do something else, basically. And I was telling her, this is how I feel about the situation if it happens. And I didn't think I could do what she was saying I could do, even if it happened. This was upsetting to me because one of my triggers is feeling like I'm not being believed. I was telling her about how I felt, and she was basically trying to convince me of something else. I wasn't in the right mindset to hear other options at this time, basically. And I told her, after going back and forth, hey, I'm getting really dysregulated. At this point, I knew I was autistic. I knew what meltdowns felt like. And I told her, I'm on the verge of a meltdown. Let's please switch topics. Like, I more just wanted her to try to understand me instead of trying to tell me I would feel a different way than I thought I would feel if this thing happened. However, she did keep trying to convince me I would do or feel differently. And I had a meltdown. And I was talking calmly and slowly, kind of similar to now, but with more warmth and depth and feeling, not as blunt as I'm talking right now. And I went from that to yelling. It wasn't okay that I was yelling. I ought to have gotten off the call. However, as a provider myself, who worked with autistic kids, and they would yell at me, I never once got frustrated at them. I never yelled back. I never took it personally. And I had ways outside of our sessions of regulating and processing. And I was always regulated and co-regulating with these kids at work. So while it was not okay that I was yelling at this therapist, how she reacted was by yelling back at me, which was just so unbelievably unprofessional. I didn't end up seeing that therapist anymore. The last therapist I saw was a couple years later. It was at the end of the end of the summer 2025 last year. As background, I had a spiritual awakening in 2024, about 2 years ago, where for 3 weeks I had no mental or physical health symptoms that I had most of my life. At the start of 2025, I stopped working and I radically changed a lot of things in my life due to my mental and physical health. 6 months later, last year, I'd completely healed all my physical and mental health issues that had to do with me, specifically with myself. I didn't realize that these things were healed at the end of the summer, though, last year. And 24/7 since the start of 2025, I'd been constantly working on mentally and physically healing myself. So I thought by getting a therapist, since I knew what I wanted now, and I knew what I didn't want, that I was being responsible. In hindsight, for me personally, in my journey, I had already healed. I didn't recognize that till November. I healed my social anxiety in November. And it wasn't until January of this year, 2026, that I started identifying as being healed. Since then, 6 months later, I haven't done any intentional healing, which I had been doing since a few months before 2025. For me, it would have kept me in this cycle of healing instead of going to this mindset of I'm healed. And now I'm just kind of sitting in that, being healed. I didn't know this in the summer last year. So I tried to get a therapist. In our consultation, I was very hesitant, and because of what I'd gone through before. And she asked me to at least try out 3 sessions with her before saying no. And I agreed. I also told her I only wanted to talk about my trauma. I didn't want to get treatment for or talk about my specific diagnoses. I was diagnosed with a lot of things: anxiety, depression, PTSD, ADHD. But I told her I didn't want to be diagnosed with autism or DID. And I explained very specific reasons why to her. She said that made sense, and we had our first appointment. She wanted to start with this exhaustive questionnaire. And I told her I didn't think it'd be helpful for me personally. I didn't explain all this to her. But again, I did say I only want to talk about the past. I don't want to talk about how I'm currently doing. The reason being because I knew what I needed to currently be doing, and I didn't want a therapist to influence that. Also, I had healed all my issues because of how I set up my day-to-day. So it didn't actually look like I was having any symptoms that would cause me to need therapy. So I couldn't truthfully answer her questions in the questionnaire because I more wanted to talk about the past and like how I felt in the past. She said she'd never not done a questionnaire with someone before, but she said she was open to it. And so I started chronologically telling her my story. I got up to age 17. She said it was great. She said we'd continue next session. And I felt pretty good. I felt cathartic to share my trauma. I felt heard, understood, listened to. In our next session, she said basically that she was upset that we didn't do the questionnaire. She said she was upset because that's what she'd always done, and she thought I was being really rigid in not doing it. This was frustrating to me because I told her I would do it. I just don't think it'd be helpful for me personally. And she agreed. So then to say I was rigid felt untrue to me. Also, she was saying that she did need to diagnose me, at least with DID, because I talked about it so much. Because she said, I can't treat you for DID if you're not diagnosed with it. So I explained again, I don't want treatment for DID. I just want help processing the trauma that caused the DID. And I just mentioned that I have it to explain how the trauma affected me. So she understood again, but it was frustrating that I didn't feel like she was inquisitively asking me why I felt that way. Instead, it felt defensive to me. But I was also upset because, again, this is the start of the session, the second session, and she said that she doesn't feel comfortable working with me anymore because I didn't do the questionnaire and didn't want to be diagnosed. That would have upset me less, her saying that. She ought to do what she needs to do for herself and her boundaries. But that she had wanted me to commit to 3 sessions and her herself wasn't willing to also commit to 3 sessions, even if it seemed like it wasn't going great at first. I thought that was very hypocritical. We talked through things. It's very long and drawn out. I also told her I really didn't like that she used the word rigid. I would have preferred she say inflexible, even though I don't think I was being inflexible. As I said, I would have taken the questionnaire if she insisted. And I explained to her how the word rigid I view to be ableist against autism, which I have. I explained that to her. She didn't seem very open to trying to understand me. I felt frustrated. Eventually, she understood where I was coming from, but I felt like she had a lot of defenses up and wasn't really meeting me where I was at, which again was frustrating because I think therapists ought to be regulated and co-regulating their clients. But it felt like I was doing that for her. After this, like 20 minutes at least of this, she said she would be comfortable continuing to see me. She felt like we were on the same page now. In the past, I would have agreed. I would have tried to keep seeing her because she was trying to work with me. However, in particular, I mean, with all of it, but particularly with me educating her about the word rigid, her response was so closed off initially, in my opinion, that I didn't feel safe seeing her anymore. So I told her this. I said, I don't feel safe sharing my trauma with you anymore. I said kind things as well, of appreciating that she got to a place of understanding with me and the like. And again, I was talking more emotionally and warmly than I am now. Her response to this, me saying I felt unsafe and I didn't want to see her again, to me seemed very defensive, where she was saying, but I am a safe person. She went on and on about lots of different things regarding how she views herself. This was particularly upsetting to me because I don't think the term safe person or safe place ought to exist, especially as an autistic person. It just is a lie. Like, you can't say I am a safe person for all people or even a certain subsect of people. You might be a safe person for a specific person if they tell you that. And even with that person, it might change into not being a safe person if you do or say something in particular. So I think it's very well-intentioned usually when people say they're a safe person or this is a safe place. They're trying to make it so. I think that's commendable and admirable. However, I think the verbiage is very misguided, and when I hear it, I feel unsafe. It makes me feel like people think they're doing enough. Not to say that all people who use this term think that. And sometimes I fear those people will be less welcoming to critiques at how to strive to be a safer person or make a safer space. I said this to her much more warmly, much less bluntly. And her response to me was, she said that she did not say she was a safe person. She said people have told her she's a safe person, and she tries to be a safe person. Again, with my ability to have these meta conversations, what she said was so triggering to me. I did remember verbatim what she said. It's fine that she didn't remember. However, it was very triggering for me to hear her say that what I was saying wasn't true right? A fact, not an opinion, as that's one of my biggest triggers, feeling like I'm not being believed. She could have said, "Oh, I don't remember saying that. I thought I said I was trying to be a safe person. I'll keep that in mind," right? But she went on and on about how that's not what she said, and a host of other things. This was very upsetting to me. I had wanted to help her change and grow so she wouldn't affect other clients the way she affected me. I did stop seeing this therapist after that session. I'm really bummed out that my time with therapists wasn't as positive as I've heard other people having with therapists. I want to reiterate that therapy, in my opinion, is neutral and can be really wonderful. I don't share all this, again, to discourage people from going to therapy. Rather, to know no authority figure is an authority over your life and your healing. If therapy is working for you, I think you ought to keep connecting with it in that way. And whether therapy is working for you or not, there are ways to help yourself. I talk about a lot of these ways in the videos that I've made about how I've healed my mental and physical health. And I think it's really positive to look at lots of different types of resources from professionals, online, things you can do within yourself, journaling, shadow work, art. And that overall, healing is an individual process. Different people are able to heal at different rates, to different extents, with certain techniques, with certain combinations of techniques. And I encourage you to keep striving to connect with what works for you. I hope my story helped people in terms of what not to accept during therapy. And I wish everyone a positive journey towards health and healing. I really look forward to sharing more of my stories about my mental and physical health, my life, and my journey here in general. And I look forward to connecting with you all more in the future.